DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.
Hey there folks, I'm Dr. Dan. Welcome to DocTalk. We're excited that you joined us today. We're going to have a great show. Dr. Mike Apley from the College of Veterinary Medicine, who is a clinical pharmacologist, is going to join us and talk to us about the changes that are occurring in antibiotics, whether it's in the feed or in the water. It's bound to be a great show. Stay tuned. Thanks.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Hey Mike, welcome to the show.
Thanks.
Folks, it's my pleasure to introduce you to Dr. Mike Apley, who is a boarded clinical pharmacologist and a professor here at the veterinary school at Kansas State University. And there's a lot of changes going on.
Mm-hmm.
And specifically, you know, the changes with the veterinary feed directive, changes in antibiotics in the feed, and it's kind of hard to keep up on all of it, but that's something that you do for us in the industry and beyond. And so tell us what got this dang thing started.
Oh man, we only got a half hour, don't we?
Yeah, no.
Well, it all started back in the 60s with concerns about the use of antibiotics in feed for livestock, and there have been numerous reports and studies up through that time, waxing and waning of interest, and things continue to build to reaching ahead now. And a few years ago, Guidance 209 came out. So the way the FDA talks to us is through guidance documents, and this is a guidance for industry, us being the industry and the pharmaceutical industry.
Right.
And they said two things in that document. They said, we don't think that the use of antibiotics for growth promotion is a judicious use. And they use the term judicious because they get to define that rather than using the term hazard, which has got a whole regulatory cascade that happens when you start that. Second thing they said is all antibiotics that are used in the feed and water for livestock are going to be veterinary controlled under veterinary oversight. Whereas now, as our listeners would know, they can go buy a bag of medicated feed, milk replacer, medicated feed, or medications to put in the feed, or water medication without a prescription.
Just go to the farm store.
Or wherever you want to go. That's being viewed as not being well enough controlled with the concerns about antibiotic resistance today. So in 2012, the final version of 209 came out after much discussion. Then they needed to give us a roadmap on how to accomplish Guidance 209, and that's Guidance 213.
Okay.
That's directions for the companies to open up the labels that are affected, remove any growth promotion claims, which are claims strictly for increase in feed efficiency or rate of gain without any disease prevention or control or treatment. And there are 26 companies that are affected and 283 products.
Wow.
And so a lot of those products are generic copies of one another or something like that, or combinations, but still a large number of labels that are going to need to be developed. The clock started ticking this year, and these companies are expected to have complied by December of 2016. So that's when all these changes will come about. Required veterinary oversight, meaning you can't just purchase them over the counter, and also that no growth promotion claims for those antibiotics through the feed and water.
So anything that has the growth promotion claim or that's coming off?
Well, there's a couple very important exceptions for cattlemen, and the number one would be the ionophores. So monensin, which we know is rumensin, one example, and then the bambamycins, which we know is GainPro. Those would be exempt from this because we just don't have any indication they're related to anything used in human medicine. And then bacitracin, which we don't use much, but for our swine producer listeners, tiamulin is one that's a pleuromutilin is not included. So those are the four main groups that wouldn't be included that are exempt from this. But tetracyclines included, any growth promotion claim, stuff like that.
Cool. We're going to take a break, folks. When we come back, we're going to continue with Dr. Apley, and we're going to talk about what kinds of antibiotics this ruling will affect. Thanks for watching DocTalk.
This Meet the Veterinarian is brought to you by Merck Animal Health, the science of healthier animals. In 2004, Dr. Corbin Stevens founded Stevens Veterinary Services in Scott City, Kansas. Primarily a feed yard and cow-calf consulting practice, SVS also has an on-site IDEXX laboratory that tests cattle for persistently infected BVD in pregnancy. Dr. Stevens is also a partner in Production Animal Consultation, a multi-industry practice. He and his wife Heidi have 3 children.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Hello, I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center. And the horse tip for today is going to be how to take the parameters of your horse and what things you need involved with that. 2 most important things that you need for examination of your horse is a stethoscope and a thermometer. The thermometers you can get anywhere at any store, and I'd always advise you to get the fastest ones that read out in 10 seconds so you don't have to get the temperature for very long. Remember, when you're taking the temperature of your horse, it is rectally, so you have to lift up the tail and get a temperature in that area that's the most accurate. Usually you want the horse's temperature to be around 98 to 101, fairly wide range, but you should do it while they're healthy so you kind of know the normal aspect. Heart rate should be around the 40 beats per minute. Talk to your vet if you ever have any questions, and that's the horse tip of the day.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley, and we're with the College of Veterinary Medicine at Kansas State University, where Dr. Apley is a boarded clinical pharmacologist and is a national and international leader on many of the topics having to do with antibiotics in food animal. And when we left, we were talking about the guidance documents and kind of what got us here. Now let's start to break it down and talk about which antibiotics this is going to affect.
So it's, as we talked before the break, basically everything except the ionophores.
Yep.
And the bambamycins, which again we know is like Game Pro, bacitracin, and the pleuromutilins, which is tiamulin when it's used in swine and not in cattle. So those are 4 that are exempt, and then the next question is, well, if it's everything else, which specific uses? So the uses that are disappearing is any labeled inclusion, so say in milk replacer or in feed, that has a growth promotion claim. So only for increased feed efficiency or improved rate of gain.
Those are gone.
Those are gone, unless they're able to show that, say, for example, 10 milligrams per head per day, which is the growth promotion claim, has a claim for or an effect in preventing a disease or controlling a disease. But they're going to have to bring the data to the CVM to show that, and it would probably require some more extensive additional work with that. The thing about Guidance 213 is it holds a carrot out there that says if you just want to come in, pull the growth promotion claims and add the part about we are going to require veterinary oversight, then we'll just let you do that without opening up the rest of what we call the package, where they might be required, well, you need to update this, that, which can run into millions of dollars. So examples that our listeners might use where they will now need a veterinary authorization to do that would be, for example, using oxytetracycline or chlortetracycline in the feed of newly arrived calves at 1 gram per 100 pounds per day. That's a therapeutic claim, not prevention, not control, not growth promotion. You can still use it, but you'll have to have a veterinarian provide what's called the veterinary feed directive.
Gotcha.
And the VFD will require veterinary supervision or oversight. And the FDA Center for Veterinary Medicine is leaving the definition of that veterinary oversight up to the states. So each state will be deciding exactly how they will define that. And it could go as deep as how often a veterinarian would need to examine the animals or talk to the owner. It could be more superficial than that. So that's the big change.
Well, and I think the big thing is that one of the big changes that's going to happen is the veterinarians have to be on the farm. I mean, yes, the veterinarian's on the farm today, but it's going to put the veterinarian in a position to really serve rural America by being on the farm proactively rather than reactively.
And everyone needs to understand that this is a way to put the veterinarian in a position of being responsible for maintaining the tools we have today. Judicious use, do we really need to use these, and are we using them in the best manner? That's going to be up to your veterinarian to help a producer define and understand, and the eyes are upon us.
Yep. Well, we're going to take a break. When we come back, we're going to talk about the oversight, just like what we're talking about here, and things that will be required for producers to utilize these products with the new guidance documents. You're watching DocTalk, and we'll be back in a minute.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, it's Dr. Dan with your On the Farm tip, and today we're going to talk about downed animals, specifically beef cows. When we have downed animals, we can't move those animals by dragging them or lifting them with chains. What we have to work with is we have to pick those animals up to move them to a different location. You're going to want to use a sled, a lowboy, the bucket of a loader, something like that to move those animals. Once you've moved them, you need to make sure that you provide shelter, nutrition, and water for these animals. As they continue to respond and rise, those animals will go back into production. If they don't, make sure that you consult with your local veterinarian and make sure this animal gets the best possible care. You're watching Dr. Thompson here on DocTalk on your On the Farm tip, and we'll see you down the road.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Baytril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytril 100, right the first time.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here with Dr. Mike Apley, who is a boarded clinical pharmacologist and a national and international leader on pharmacology, specifically when we start to talk about antibiotics and food animals. There isn't anybody that is more of a go-to type person for information in the world than Dr. Apley, and it's an honor and a pleasure to have him here on the show. Mike, when we talk about the new regulations coming, there's going to be some oversight. Now, how are we going to get this done and still be able to, do our business?
Well, we're working on that.
Okay.
And that's why each state is going to be responsible for defining their oversight. And I think the state boards of veterinary medicine, boards of veterinary examiners, called different things in different states, the agriculture entities in the individual states, state associations of veterinary medicine, state cattlemen, swine producers, whatever types of groups you have are pretty well aware of this now, and they're working together to say how do we make this happen. And there's concerns, for example, what if I need to have drug X for the feed? I'm having an outbreak, I want to add it in the next mix, and I don't know where my veterinarian is, or I've got to get a hold of them. We've got to start laying those plans now on how to do this, and you need to have a working relationship with your veterinarian. They need to know your operation, and you need to know them, and they can write and authorize these. The duration of the veterinary feed directive, which is will be required for all feed antibiotics, is still up in the air. It's going to be dependent on the label for each drug. So, for example, there's 2 versions of a drug called tilmycosin right now, one for swine, one for cattle. One, the authorization is good for 45 days, and the other is good for 90. So we're hoping that we have some consistency in the duration.
So that's how often they have to get the veterinary feed directive?
To
Every
authorize.
45 days or every 90 days?
Yeah.
And we really don't have that on our parental drugs.
No.
Now, as far as the definition, when I would write scripts as a consulting veterinarian, I did every quarter.
Right.
But
so we might have as long as up to 6 months now is what they're saying, but it will depend on individual drug label, and that's all up in the air, and we'll know more as we move forward.
But the thing is there's going to have to be that VCPR, define clinical cases, and have those documents in order. It's no different than animal welfare or anything of that nature. It's really going to be in the best interest of the producer to have these kind of definitions laid out when they're asked.
It's a planning process, and it's nothing different than what you have to have in place now to purchase a prescription injectable drug. So we're just adding those in.
So anything else on the oversight that people need to be aware of? When will this kick in?
December of 16. And it depends on the individual labels. If there's an individual label that's approved before that, it might go into effect sooner. So our listeners need to sit down with their veterinarian and discuss every drug they're currently using or may use in the feed and water, every antibiotic, so that they can start laying plans for this on how that'll be taken care of.
Well, it's great. When we come back, we're going to discuss with Dr. Apley what's next, and talk about the veterinary feed directives and other drugs that may be affected. You're watching Doc Talk. We're glad that you joined us.
The BQA Tip of the Day, sponsored by Boehringer Ingelheim Vetmedica Inc.
Hey there, folks. Welcome to today's BQA Tip of the Day. Today we're going to talk about injection sites. The first thing, location of that injection. We want to make sure that we go in the target area of the neck That's the triangle with the vertebral column, the point of the shoulder, and above the jugular vein. After we look at the location, we want to select the proper needle. I use 16 and 18 gauge needles most all the time for all injections of cattle. For sub-Q injections, I will use a 5/8 inch needle or a 1/2 inch needle. For IM or intramuscular injections, we'll use a 1 inch to 1.5 inch needle. Sub-Q injections should be administered at a 45-degree angle, and the IM will be perpendicular straight into the neck of the calf. That is today's BQA tip of the day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley. We're from the College of Veterinary Medicine at Kansas State University, where Dr. Apley is a clinical pharmacologist and a national and international expert on food animals and antibiotic usage. And we've talked about everything that's happening, but you know, what are we going to be facing next? What are we going to be looking at next with antibiotics?
When you split uses of antibiotics in food animals into different categories, you have therapy, prevention, control, and growth promotion. So growth promotion's leave-in for antibiotics. And our current administration in the FDA Center for Veterinary Medicine considers the use of antibiotics for prevention and control of disease in food animals to be a judicious use, an appropriate use, and they lump it in with therapeutics. There's multiple advocacy groups which would not lump that in. So prevention and control is the next thing to look at. I think everyone's well aware that those are going to be the next uses.
And those would be stuff like metaphylaxis or mass treatment on arrival for new cattle.
Yeah.
And would that be just in the feed, or would this be feed and parental?
Don't know. It seems like feed and water, because it medicates the whole herd or flock at the same time, seems to be having a higher focus on it. Injectables, if applied to the whole group, surely aren't out of the question to be discussed. So for beef cattle, it'd be anything administered to the group on arrival at the feedlot, for example. Or if you put something in the feed to prevent or treat respiratory disease to the entire group at the time of weaning. And in pigs, when they're weaned and put into the nursery, you know, those types of things where we know that this disease is going to occur probably at this time because of historical evidence, and we're going to try to get in ahead of it. Those are going to be the things that are going to be discussed, and the reasoning is, or the assertion on the part of the advocacy groups is the only reason you have to use those is because of the nature of the facilities. And therein is the real crux of the discussion, and what it always comes down to is it's the nature of the production facilities that require those uses. Which
you said something to me the other day that has stuck with me on this topic, and it gets back to there aren't new classes of compounds coming out, and the thing about whether we get wrapped around the axle with the activist groups or things of that nature, put that all aside. As a responsible industry and as a responsible profession, it comes down to, do we want to have products that work in the future?
The last time we got a new product class that we're using today in food animals is 1978. We've had new modifications, chemical alterations, and overcoming some resistance, etc. since then, and a lot of new really good antibiotics. But the last time we got a new class was 78.
Well, thanks for being on the show today. It's a great show. Great to have Dr. Apley spend some time with us, and we're going to have to get him back on and have a further discussion on this topic for sure. Thanks for watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do on DocTalk, you can find us on the web at www.vet.ksu.edu. Thanks for watching the show today. I'm Dr. Dan Thompson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Pyramid 5 plus Presponse SQ, a market leader in combination respiratory vaccines.